All right, welcome back to NP Nerd, and today's short video is about wound debridement and the importance of wound debridement in wound healing. So what is debridement? Debridement is a critical step in wound care because it involves the removal of the dead tissue that could be covering the wound. If you look at this picture here, you see all this yellow that's covering the wound. This wound is not going to heal fast because all this dead tissue, it's non-viable tissue, and it's just covering the wound bed. It's hindering the wound from receiving the nutrients that it needs from the body in order to heal. So debridement means the removal of this non-viable tissue. Goals of debridement, in the procedure of debridement, there are so many different methods you can use to achieve debridement. Okay, so debridement means the removal of this yellow tissue or black tissue that's covering the wound. But there are multiple ways you could get that done. One of them is surgical debridement, which, as you see here in the picture, this is depicting the surgical debridement of wounds. And you can see here, why is it called surgical? Obviously, because it's there's a sharp object. So either a blade or a curette can be used here. Enzymatic is another method of debridement, autolytic, and mechanical debridement. All of these are methods of debridement. And the primary goal of debridement really is to reduce the bacterial load in the wound and remove the barriers to healing and create an optimal environment for tissue repair. This wound right here, because it's covered with all that yellow, there's bacteria inside it and underneath. It harbors a lot of bacteria. So this has to go. Regular frequent debridement is important. The study done by Wilkinson in 2018 found that regular debridement and patients who received more frequent debridement experienced faster wound closure rates compared to those who got less frequent debridements. So once a week is typical time for debridement for wounds. Especially this picture right here, you can see this is a diabetic foot ulcer, and you can see that not only the clinician is removing the callus around the wound, but they're also going inside to remove the yellow and black tissue that's in there, which is Slough and Eschar tissue. And another study by Jones in 2020 showed that the debridement not only accelerate the wound healing, but it also reduced the risk of infection, like I was talking about earlier. When this yellow tissue is stuck on the wound, it harbors bacteria. So it needs to be removed in order for the wound to turn pink like this and to have granulation tissue. So the bacteria load can be reduced. So the research here, it demonstrated that patients with chronic wounds who underwent routine debridement had lower incidence of wound infection. And debridement is essential in wound care. It's particularly important in chronic wounds. It removes necrotic tissue, it encourages healing, and of course it prevents infection. Only trained wound care providers are able to perform debridement, especially the surgical debridements that involve sharps. So to learn more about that, to learn more about when to debride a wound, when to not debride a wound, and what are the different methods of debridement, you can check out npnerd.com and sign up for the comprehensive wound care course. And here in the next slide, I have a sneak peek into one slide from this course, and it's lesson 7. Lesson 7 was about managing infection in the wounds. And part of this lesson was debridement. One method of debridement is chemical debridement, which is cauterization. As you can see here, there are two pictures here that are showing two examples of wounds that you're going to need to chemically cauterize them, which is a type of debridement. So silver nitrate is used in chemical debridement, as you can see right here. It's used to debride wounds that have rolled edges, epibole. You see this picture right here where the cursor is? That's called epibole because the wound edges are folding on itself pretty much. You need to cauterize that in order for it to heal. And the other type of wound that you want to cauterize is hypergranulated tissue. Look at this here, how the hypergranulation is literally sticking out of the wound. That is not a healthy tissue and it needs chemical debridement. Happy studying and have a good day.